This is All India Radio. In the program Spotlight, we now bring you a discussion on COVID-19 updates. The participants are Dr. Narendra Saini, former Secretary General, Indian Medical Association (IMA), and AIR correspondent Renu Kataria.
Doctor, the Health Ministry says that we have to learn to live with COVID-19. What does this signify?
It means that this virus is going to persist. First, we thought that within some time it may be seasonal and it will go away. But over the time we have seen, it started from China and now it is almost 5 months is there. It is persisting and it is going to persist. So we have to live with that, and so we have to adopt certain precautions which are associated with this virus.
Revised discharge policy for COVID-19 patients is issued by the Union Ministry of Health and Family Welfare. What is the rationale behind this?
The rationale behind is that previously we were thinking that all patients who were COVID positive, we were putting them in hospitals. But now we found that there's no point in putting them because it is so much prevalent in the society that there's no point in putting them in a hospital. If there is not a much problem with these patients, they're not having respiratory problems, they are asymptomatic, then they should be quarantined at home. Even we have seen that tests which we do, these are not Indian tests. These kits are taken from abroad. Some tests are being manufactured in India also. Is just 70%. So 30% still we are missing in the society. So most important is to have certain cautions which are necessary. So there is not much of a use of in patients in the hospital. So that's where the rationale is.
Doctor, there's an increase in the asymptomatic cases as we have been seeing. How do we stop that fight against this pandemic?
We have to live with it. And we have to change with the present scenario because we do not know. We know about this disease. Daily we are learning. At present, what we have learned is that out of 100 patients, 85 will have mild symptoms. Out of this 85, which I am saying, they do not need any hospital admission. Out of this 85%, maybe around 30% people will be asymptomatic. They may not be having any fever. We know that this particular virus causes symptoms are having fever, sore throat, difficulty in breathing, mild. But these 25 to 30% of patients may not have any kind of these symptoms at all, but still they are carrying this virus. So what is happening is they are not having problem with themselves, but they are creating problem for others, mainly those who are old, those who are aged, those who are having some other problems, chronic diseases, they will be getting this infection and maybe in more severity. So important is all the time if we are maintaining that good hygienic habits, maintaining that distance which is now being talked about by the government also, and putting our face cover and keeping our hand hygienic all the time, cleaning, washing our hands all the time as much as possible. So if these small measures are taken, then I think nothing will happen, and these asymptomatic patients, asymptomatic people who are roaming about, they will also not be creating any problem to other people.
Doctor, we have seen our fatality rate in the country continues to be around 3.3%, and the recovery rate has climbed up to 29.9%. What do these numbers indicate?
Number indicates if I see around the world, this is a new disease. We call this as novel coronavirus. Novel means new. We were not knowing anything about it. And you said our is 3.3, but if we see average around the world is much more than that. It means we are doing fairly well. It means out of 100, around 3 patients will die. 97 will recover. But in this 3% also we have seen the people who are dying are mostly of older age, more than 65 years of age. Plus, out of those 65 years of age, those who are having diabetes, hypertension, or maybe HIV, maybe of cancer, and they were not taking the treatment which is required for a diabetes or a hypertension. It means chronic patients who were not taking their doses which were required for hypertension or diabetes, and they unfortunately got this disease. So these 3% are people who are dying. The important thing is that mainly people are safe if they keep themselves hygienic, keeping a distance, and if you are chronically ill, having some diseases, you please continue to have those kind of treatment which are required for you. Then you will have no problem at all. So do not get confused. Do not get excited about this. Do not have any anxiety about it. Just keep cool, stay healthy, stay at home, maintain a distance. That's what important. The second question you asked me about the other statistics was that so many people are getting healthy. That is a relative issue, relative word, that out of so many admitted, these number of patients are getting cured. But I will say in that more important is the number of people who are dying, which is very much less than which we if we compare with any other disease. And fortunately, the people who are dying are only those people who are not taking their treatment part, which they are having other chronic diseases.
Doctor, what is the incubation period of the coronavirus disease?
This incubation period is varying. One is people should know what incubation period means. Incubation period is moment virus enter into my body. Suppose I am getting infected with the virus. This virus getting into my body and then it's showing the symptoms. The symptoms of this virus is fever, sore throat or diarrhea. Sore throat and difficulty in breathing, myalgia. So from entry towards getting the fever symptoms, this is around 2 to 14 days. So much of variation is there. It might be some patients 2 days. Average, I will say, it comes out to be around 5 to 7 days.
Some experts are talking about herd immunity, doctor. What is your take on this?
This virus is in the society. So it is getting from one person to another, we are getting this infection. That is how the virus is also. Like a human, we want to survive in this world. Similarly, a virus also want to survive in this world. For that, what is needed for the virus to survive is, if it goes to one person, can survive only when it goes to another person. So that is the way of transmission of this virus. And once we, as people in this world, 70% of people we get in this world immunity, then the virus will not be able to transmit itself. Suppose if we 3 people are there, you and me, another person is there, if we all are having some immunity, the virus cannot survive in the surroundings, in the environment. It has to live in some human being only for its survival. So if people all get immunity, then this virus will die of its own. So this herd immunity that means that society gets immunity to this virus that becomes a herd immunity. This herd immunity can be acquired by 2 ways only. One is most of the people get infection. Then it is not a good thing to have. For that to herd immunity to happen, at least around we have seen 70% of people getting infection, then it will die of its own because it will not find a way to go to another person. Other thing to get a herd immunity is a vaccination. So till the time we do not get a vaccination, we have to avoid the virus because we do not want the other way to get a herd immunity is getting more people infected. We do not want that. So we have to wait till vaccine is there. All this distance we should maintain so that we can have. So this is the meaning of a herd immunity. When the society gets immunity against the infection of this virus.
Sir, talking about the vaccine, efforts are also in our labs across India to manufacture the COVID-19 vaccine to check the deadly virus. Doctor, how soon do you think we will have one?
There are around, if I see the statistics around the world, WHO has around 80 companies, organizations or different countries are working for the formation of the vaccine. More than 80. This is the first time in the world that so many countries, so many organizations, so many pharmaceutical companies are putting their effort in making a vaccine for this because this is a pandemic which has come. But we have to understand that a vaccine, if we go back into the history, vaccination, if for any disease, for vaccine to form, it takes around more than 10 years. But here we are working very fast. But whatever fast we work, but it has to go through certain phases, which is first is identification of a virus and then in the human trials, which is phase 1, phase 2, phase 3. These are very important trials. You cannot omit the step. So if we go at present, we find that maximally we have gone up to phase 1 trial and certain companies have gone to phase 2 trials. India is also one of the partner with Oxford University with the Serum Institute working with that. So maximum, and I go with the WHO statement also, it will take around 8 to 9 months more.
So we have also heard about plasma therapy. How useful is plasma therapy and will it work in COVID-19 disease?
Plasma therapy is one of the way of a treatment, but it is still not a recommended treatment. It is a research. People should not take it that, yes, every patient will get a plasma therapy and they will be treated. No. One of the research projects which ICMR has approved, which WHO has approved. But it is not a final say that, yes, we can go. Plasma therapy means that you are giving some antibodies to a patient, which those who have recovered. From there, we take a plasma, those antibodies, and start giving the treatment to them, start giving this plasma to these patients. But plasma therapy has its own disadvantages also. Plasma is allergy also. There is how much antibodies are present first, how much antibodies are in that person is there, which will be beneficial to that patient, and which stage of the disease the patient is. In every stage of the disease, plasma therapy will not work. So these experiment has to be done. Before that, we say, yes, final thing which we have got. Till now, I will say it is on an experimental stage.
Doctor, we also know that the government is promoting Arogya Setu app for contact tracing. What is your view on it?
It is a very important thing happening this Setu because, as I said, the only way of at present preventing disease is the contact tracing. This Arogya Setu app is a very good way of doing things. South Korea has done it successfully. They are able to curtail it. China, if they are able to stop the transmission of this infection, was through these kind of apps only. I think the very good app which government has brought it, people should download it because through that you can come to know also that how much you are going to be facing, you are having, I will say, problem of transmission of infection you will be having, and which area is having more kind of such kind of people, what kind of a stage you are in is a very good way. All people should compulsorily download this app and use it.
Doctor, we have reached the testing capacity of almost 1 lakh per day. Do you think we should further increase our testing facilities?
This testing capacity, yes, the more and more people we should test is good, but at the same time, I feel a country like India where this cost is also a great factor in this. The cost of this is very high. And secondly, when I see 30% of this is just false negativity, it means 30% we are still missing with even with doing this test. And secondly, present the statistical data, we see just 4% of positivity. People have to understand, and I will say we should do this more in red zone area or containment zones. And rest, we should make people aware about the precautions which they have to take. Unnecessarily doing these tests where the false negativity is also very high, the sensitivity is low. I feel we should be restrictive. The way it is going on, I feel it is fine. People have different takes on it. But I feel that there is no point in doing such tests so much, which has a cost also, not a very small amount, a high cost. And when the sensitivity is also not very high, 30% still we are missing. I think more emphasis should be on containment and on other things which we are doing, creating awareness among people.
Right, doctor. What precautions one has to take after the lockdown is over?
Till the vaccination is not there, as government is also saying and the scientific community is also saying, we have to now live with this virus. We have to change our way of working. We have to change our attitude, and something good is happening in that. One is maintaining hygiene. Frequently wash your hands and your surrounding things. At least we have to learn that whenever, simple formula, whenever we want to have our hands, any touch on our face, mouth, nose, our hand must be washed or must be sanitized. Second, when we go out, we must keep our face covered. Either use a mask or use a face cover. Simply a cloth, which our Prime Minister also said, a mask face cover, which should cover your mouth and nose. Second, the third one is maintaining physical distance. At least 3 feet of distance, good enough for that. Somehow, if you cough and you do not have putting your mask around it, have that habit of putting a tissue paper on when you cough, have a tissue paper on your mouth and nose so that whatever transmission, whatever droplets happen, they happens on the tissue paper, and put that tissue paper in a dustbin. If you do not have, then use your elbow to do it. So cough etiquette has to be there. If we do these smaller things, I think this will go away.
Thank you, doctor.
Thank you so much.
You were listening to a discussion on COVID-19 updates. The participants were Dr. Narendra Saini, former Secretary General, Indian Medical Association, IMA, and AIR correspondent Renu Kataria. This program was produced and presented by the News Services Division of All India Radio. You can listen to it on our mobile app News on AIR. This program is also available on our website newsonair.com. You may email your opinion about this program